Dr. Nikhil, you are a medical oncologist and you must be seeing so many cases of cancer, especially prostate cancer, day in and day out. And the incidence of prostate cancer is on the rise for the past 1 or 2 decades. And there is also a thought that lack of ejaculation or a lack of sexual activity increases the risk of developing prostate cancer in men. Is that true?
Definitely the prostate cancer is on the rise. More so in the Western world, but also in India, the numbers are definitely mounting up. And again, like most of the cancers, even the prostate cancer is a multifactorial disease. So there are various reasons why the cancer is on the rise. One is definitely our longevity is increasing. So as the age increases, it's just that there is, you can say the base is increasing. So the more number of patients are effectively more chance of getting a prostate cancer. You are so right. Then of course there are certain other risk factors like, decreased physical activity, obesity, and food. So all those kind of contribute, which again forms a risk factor for most of the cancers, including prostate cancer. Third is remains smoking. Fourth is the certain environmental factors. Fifth are genetic. So there are so many reasons why the prostate cancers are there and they are on the rise. In addition, our diagnostic ability has improved in the last, I would say, couple of decades, where even in the tier 2 and tier 3 cities, the tests are available, like the basic PSA or prostate specific antigen blood test. They are often done and the pickup rate is more, the scans are easy, the MRIs are easy, so are the CT scans. So all this investigation build-up also has led to a better diagnosis, or I would say that's the reason also numbers are increasing.
Earlier diagnosis.
So that is one way of looking at the numbers. Coming to the second part, that is ejaculation and whether the lack of or reduced sexual activity makes the person more prone for cancer, and that's a quite interesting area which there is a lot of work which is going on, especially when you look at one of the studies which came in, I think in 2016 from Harvard, where they actually looked at into almost like 30,000 plus patients, I would say not patients, the individuals in the population, and they try to look whether is there any correlation between the sexual activity or ejaculation with respect to the risk of development of prostate cancer. Interestingly, what they found was if the sexual activity or ejaculation crosses, let's say 20 number in general, vis-a-vis when you compare to 4 to 5 in a month, then there is almost a 20% risk of getting cancer of prostate for the men with the lesser, I would say, ejaculation or sexual activity. So that is quite interesting, and because that's the science which has told us this particular information, we need to look into that carefully. Having said that, is that the only reason for getting a prostate cancer? Probably the answer is no. There are certain other, I would say, underlying reasons why also which might be contributing to this. There is a suggestion that the people who are having active sexual activity or having ejaculation numbers what has been described in that particular study, they are expected to be more physically active. They are expected to have more healthier lifestyle, and that also may be contributing for their better prostate, I would say the lesser risk of getting a prostate cancer. Although there seems to be some correlation, whether it's strong enough to really give some recommendation, I don't think even I am the authority and probably nobody has given any recommendations but that's an observation which one can keep in mind. What is in our hands remains always the easier ways to have maintaining a better diet, exercise and all that, and of course to understand this information. And there is a bit of a science behind it why this particular relation has come up, because higher the sexual activity, higher the rate of ejaculation, the so-called inflammatory substances which will be eventually come out of the prostate, and that will lead to reduced inflammation of the prostate, and that will lead to the lesser risk of getting a prostate cancer. So lesser inflammation, better hormones, and for that matter, so all those things are kind of contributing, although there is no one right answer over here, but there is a definite data which is out there in the open.